Hello, everybody, and thank you for watching the Storytelling Alchemist show here on the Los Angeles Tribune. Everybody, thank you so much for supporting the show. It's now been back on the air on the LA Tribune for just a little over a year. And I'm really excited about today's topic. We talked about this a couple weeks ago in another episode, and this is going to be something I'm going to be doing off and on as a series throughout the year, because I think it's something very important to speak about. And basically, it's the theory that I believe, and trust me, I am no scientist or no doctor, and I just am a guy that has thoughts, and I think and I want to explore them. So, so I invited two experts on the show this morning, Dr. Onisor and Dr. Amit Goswami, and we are going to be talking about the subject of, I believe the world is suffering from a global post-traumatic stress. We can call that whatever we want. I believe the Mohawk describe it as Watiko. Some other people describe it as something else, but we're going to have that discussion right now here on the show. So thank you, Dr. Onisor and Dr. Amit, for being on the show this morning. Well, I guess it would be evening where you guys are at. And I guess I will just throw out the question to start off with. How do you guys understand, and do you believe that the world is suffering from some kind of trauma? Maybe not necessarily PTSD, but some kind of trauma that's making the people that react the way they are. And I guess I'll just throw out that question.
It certainly is a trauma for many people, especially people who I hate to say this, but there are two kinds of reactions to this. One kind of reaction is taking some responsibility for the situation that happened. And the other kind, and this is the kind that much of the world today, especially the affluent people, take, that they have no responsibility for anything. For natural calamities, if you take the view that this happens and it is nobody's fault, then already it's not a traumatic situation. Of course, we see people die around us and we become scared that I may get it too. It's an infectious situation, so one can get it. But there is a responsibility that we also have. If we have a strong immune system, if we are healthy, then we fear less. There are two kinds of people who are not healthy. One is the really vulnerable people who are already sick, and their case is a little different, and they have a real traumatic situation because they are vulnerable. And then this other kind who just imagines and the vulnerability and also have trauma. It is the same kind of trauma that happened after the 9/11 bombing of Diamond crash on the big building. People didn't really need to be afraid so much because of the incident, because obviously it's a very expensive affair. They didn't use common sense, nor did they use their own sense of responsibility, that terrorism is something that we have some responsibility having created it. So my take on this is very sad, that people feel that they have a reason to be very angry, and yet they want to function as if nothing has happened. They don't even want to use mask, something very simple to do. And so bulk of the situation that happened, panicky situation that happened, that it got to the level that it did, when it is kind of traumatic and panicky, when million people are dying every day, then certainly it is fearful. But it is still something that one should be able to think a little, because it's not, even when it attacks, even then you get 14 days or so to recover. Most people don't die before a few days. Their immune system holds on unless they are so careless about breathing, that their respiratory system is affected. So, I mean, those are details. But the net sum and summary, to my mind, is that if people were a little responsible, then they could avoid the trauma.
Yeah.
All right. Can I add
Yeah.
something?
Yeah, of course.
Because, I mean, I guess you know that it's not just the trauma that is going on right now, right?
Yeah.
Because all this physical infection and, let's say, social distancing was replaced with social unrest. Yeah. So all this infection became also a mental infection, in my opinion, and even an intelligence test for everybody. Yeah.
Right.
Because there are ways to increase immunity, not just that. Yeah. So what's happening now, you see what's happening in Canada and everywhere. And also the idea that most of the so-called vaccines may not be so effective, and all this bioengineering thing. And there, of course, there's indeed this reluctance, especially of the American public, to do anything that corresponds to personal growth, like asanas, pranayamas, and all these good ways which exist, from the past, and they really work, And of course, taking responsibility, because that's the first step in quantum healing as well. When you come out of the victim condition, but there's a lot to go until there, and you assume responsibility. But again, people are insensitive to their own health indeed, and they don't want to do anything if we go only on the health discussion. Yeah. And either in not so developed countries, they are not so educated. Yeah. Or in developed countries, they are pampered. Yeah. And they expect the governments to do something. And what is the government doing? Everybody sees now. Yeah. It's blatant lies, and nobody wants to be free. Yeah. So it's again, people want their freedom, but they don't take responsibility. So obviously we support the people to have freedom to choose to get the vaccine or not, for example. And if not, to assume responsibility, of course, to boost immunity naturally. It's not only about that, because what's happening in Australia is a great example, unfortunately, of what governments do. Yeah. So yes, human rights are under attack constantly from left and right. So to take the discussion a little bit challenging, maybe for some of the audience and you.
It can be challenging, but I think it even goes back, like in my lifetime, I've seen Ronald Reagan be shot, and I've seen the Challenger incident happen back in, I was, I guess 12 years old when that happened. And so you need to just keep on fast forwarding. I mean, there's just a lot of trauma, I think, that's unresolved even prior to the last 2 to 3 years. Like Dr. Goswami just mentioned, 9/11 and the World Trade Center. I remember that day. Yeah, of course it was when it happened, and then we fast forward. But you guys have mentioned, taking responsibility in that.
Yeah, and it's only the physical health, it's emotional, it's mental. The trauma, again, what is the trauma? It's an unexpected emotional experience that we encounter, for which we have no strategy to deal with. There were so many options given, is this and that, So the experience can be dramatic for us, and we may be left feeling isolated. It's an isolation which is happening also in the inside. And of course, there are two categories of traumas: small traumas or big traumas. Yeah. So it depends. I mean, I don't know if you know, but again, there are so many people who committed suicide in this period because of all this fear which was induced with and without reason. Of course, those people, it's not that they were completely healthy before. Obviously, they had problems. Yeah, they were not living a healthy life. It's clear. Yeah, but still, so it's indeed, I can see what you're saying with the post-global trauma.
Yeah, because what I've been looking at over the past year is, in business, we'd call zooming out. In quantum physics, I think they would call it be the observer, the ultimate observer in your life. But in business, we say zoom out and take a look at it. And if you look at it from that perspective, you feel a lot more empowered, as opposed to being wrapped up in all the fear. Your fear of responsibility and saying, hey, I need to take care of myself is there, and be responsible with your own body. But at the same time, you're not paralyzed by fear when you're the observer in your life. And I think that's a substantial difference.
Obviously,
look at it from a psychological point of view. Human beings, when we are very young children, we don't have mind operating yet. So a baby newborn baby, she responds through feeling. We do have a feeling self like mammals, dogs, cats, cows. They are conscious, but they process with feeling, not with thinking. So we do that also as a baby. Up to 1 year, more or less, the thinking self is still not built. So it's a feeling self that governed us. Now, what happens in traumatic situation is that the shock of the trauma gets us into that feeling self. This is why we can't memorize trauma in a reasonable, logical, step-by-step way. The sequencing apparatus, the hippocampus, just goes out of commission. And that is the problem with trauma, because any part of the traumatic memory will trigger the reaction that I had. But notice why the reaction is coming. Reaction is coming because we feel helpless, childlike. We don't have anything to protect us. For an adult, this is just not true. So why do we let ourselves, children aside, children, when they see a person, they're near and dear one dying, it's hugely traumatic. So this is just, I'm not talking about children, really. But for adults, we certainly should have the thinking apparatus unless it's a sudden event. This is the complaint that I have. This is not a sudden event. You saw Challenger blowing out, sudden event. As a child, 12-year-old, sure, it will be affected, it will be a trauma. I see a bombing, sure, it will be a trauma. Even a child, I saw lots of beggars when it was famine in the place that I was born, and that was traumatic. But this is unbelievable because, first of all, we are not children, and second of all, the thing happens in a slow way. The information comes to us very indirectly. How many people really have seen a person dying of COVID? Not very many, okay, except for doctors and healthcare workers. We really don't see people dying around us. Yes, some of us do, unfortunate ones, but most people don't, because the dying percentage is very, very low. Although it's high, but it is very, very low considering the total population of the earth.
Yeah.
So this is the really a bit unbelievable. And also unbelievable is the way that politicians react to this. They're so used to pampering the electorate today, everywhere, every country, but America and Europe especially. These affluent countries especially have no need to really panic, or they had the money, they did do things eventually, a bit slow perhaps in the United States, but being fast really did not help Europe all that much. So everybody was basically in the same boat. But why is the popular reaction so bad? Especially in America, it was really the worst among the affluent countries. This is very hard to understand, except by saying, of course, what we started with, that people just don't take any responsibility anymore. And they really feel helpless, childlike, and that's why so many cases of trauma, or people even using the word trauma.
Do you think that, because you mentioned safety, this is, well, I think it's probably the wrong choice of words, but you mentioned people don't feel safe, I guess, is the
people don't feel safe.
And
but
so
this is a sudden event. I mean, you can take control. Look, I mean, now, okay, how do we handle panic of a really disease that spreads fast? I have been in places where cholera outbreak has occurred. Of course, you take a shot, but the best thing is to run away, go to another place. Most people in America can afford to go to another place. If COVID is really bad in your town, one could just drive out of the place and be safe. Right. If it scares you so much. I mean, one does not have to develop the panic that leads to trauma. Trauma is when the panic is suppressed. Until it is suppressed, we don't call trauma, right? So what is the need for suppressing it? I mean, you have a panic situation, you're feeling nervous, you're helpless, but you can do something because it is a slow thing. It's not coming, and it's not a tiger that has come. It is something from which we can do something. We can take a lot of care. I can stay indoor, then nothing can touch me, right? There is no way that the COVID is just specially going to be directed at me and I'm going to get it if I seclude myself in a cabin. And people are ready. United States, especially, supplies were ready. People get indefinite supply of food at home, so there really is no problem. Most people keep food, ready food all the time, canned and cans and stuff like that. So I really do not understand the phenomena of why this happens, except to say that people are just comparing themselves to helplessness.
Well, and I think too, it's part of what you mentioned, like when you think of Maslow's theories, hierarchy of needs, and then those safety needs and everything are in there, at least perceived, are not taken care of as far as health and stuff like that. And you're being told by the news and everybody every day to be afraid, and it's one of those things where I actually did get COVID in August for about 3.5 weeks, and to me, even though nobody wants to actually be sick, I thought it was great because I was in meditation for 3.5 weeks and I didn't have to think about work or any other things. And of course, no, I didn't want to do it sick. I would have rather doing it sitting on the beach in Maui. But it's one of those things where you have to look at it the way it is. I got 3.5 weeks to process through things and look at it, and in a sense, that's, I don't want to say it's a blessing, but it is what it is. So you just have to look at it at a different perspective.
You know what? Even Amit had 2 times, even recently. Like he was completely out in 5 days. So
oh, really? Wow.
Really, the thing is to act immediately and to know what to do. So that's not such a problem as it's presented.
So what are things that you think, I mean, we mentioned responsibility. What are some things? There's a lot going on. There's more than just COVID going on in the world. But I think it was interesting because I just got a client that's a nurse practitioner, and she is upset. She's getting over the fact that she gets snapped at for the littlest things. People come to the emergency room and then they just snap at her. And one of them is, just a simple question, have you been vaccinated? And I don't want to go down that whole rabbit hole, but she's like, I just asked the question. I didn't need the long winded explanation. But there's more than I think that just this going on. There's the news is full of things that will cause us to trigger us or whatever we want or whatever's going on in us. What do you think are some things that people can do to cope? I mean, to me, I would say turn off the TV and don't watch the news, but there's other things I'm sure we could do.
Definitely, it's a good idea. But then again, it's really backing, I mean, eventually, like it is a crisis and we should make use of this crisis. Yeah, because crises are moments when humanity grows. That's very clear. Look in the past, now we are kind of low, I would say, most.
And it is fortunately, COVID has disappeared from the news more or less, because people are feeling more safe and people are going out. I guess the thing that makes them most panicky is not the ability of not be able to going out. They're so used to that. That not having control on your life, I guess that's what bothers people psychologically the most. And that is that you do feel a little bit helpless, except of course, if you could take responsibility, what happens is that you don't feel that. And that is what happened to a person like me. I'm 85-year-old, belong to the very vulnerable generation. But I know that it is my responsibility to do whatever I can do to protect myself. Of course, as Valentina said, it did break down because I did get infected twice. But because of the mindset, and that mindset is just so important, I knew that it cannot harm me if I have a strong immune system. And strong immune system is not that hard to have. If you have love in your life, then the immune system will be strong. And many people should know this because repeatedly medical science is showing us, data is showing us that people who have regular love in their life, they live longer, they live happier without disease. And still, people don't recognize how important it is to have relationships, supportive relationships, because they can protect us from these situations like this. For example, if children have very supportive parents, a loving mother, that's the most important thing, then their chance of contracting serious trauma is much less. It's the parental negligence or ambitious parents who really cannot take care of their children very well. It is those children who are more vulnerable to traumatic situation and suppression. So these things have to be looked at from all these points of view. And I wish that the news people were a little more cooperative. But the news media has become so money hungry that they only want to make money out of anything. So I think part of the panic was created by the news media. You are completely right. If you could put the news media out of commission during the peak of the situation, then probably the trauma experience would be much less. News media can create trauma by itself by declaring that, oh, this is just so bad.
Yeah.
I'll give you a situation. Remember when it just first came and we had like April of 2020, and the deaths have not even reached 100,000 yet. And news media was building up so much. Oh, we're close to like Armageddon has come, total destruction, because 100,000 Americans are going to die very soon, a total 100,000. And now 100,000 Americans are dying regularly, but who cares? Nobody cares. It's just a number. I mean, this was such a stupid reaction on the part of the news. I couldn't believe it. 100,000 deaths over 2-3 months. Okay, it's a big number when you compare to flu cases, but COVID is not flu. That we should have realized right away.
Right.
So,
Well, it's the reactions to things, and you start going, wait a second, and I don't understand the science behind it, but I just sit there and go, wait a second, I don't know if I should, because everybody was in a panic around me, and I was like, let me just sit and process this for a second. I don't even know what's going on, and I think that with the work that you both have been doing for many, many years, and you guys have been publicly talking about how we can take responsibility for our life on a quantum level, and it's interesting to me that there is not more people looking at it from an observer standpoint, as opposed to, yes, of course, take care of myself. Yes, of course, take care of my immune system, do the things. But it's just still, I guess now I've been studying this for 25 years. It still surprises me that people are still not getting in this on some level. I mean, I think it's more so than it was in the 90s that people are taking responsibility for their lives. But there's still a lot of people that are still just wrapped up, and including people that study quantum physics and study healing and study quantum healing. And I'm like, you still don't see this. And so it's not really a judgment. It's more of a, I'm just trying to observe and process it. And what do you think has happened in that? Because you've been, Dr. Goswami, I know you've been in this for a long time, teaching people these principles, and you've been practicing it for a long time. And Dr. Onisor, I know you've been doing it for a while. And I know other people that have been in this. I mean, Louise Hay was teaching us 40 years ago that you can change your health just by your thoughts, with the old spiritual principles of the unity movement and the science of mind movement. And so what is it that people are not seeing in this? Or is this just the way the world works? Some people wake up and some people don't.
No, the problem is that people don't see it for a very good reason. Human beings use their mind and think a lot of things. Mm-hmm. Some people love to think much more, speak much more about something than do something about it. So the thing that disheartened me most, of course, I have interacted with, been part of, been somewhat of a leader of the first the New Age movement when it was at rudimentary level, and then when breakthrough started happening and the new paradigm was taking shape, I was one of the developers as well as one of the participants in, with others of how to grow with this new paradigm, a chance of creating a new worldview, integrating science and spirituality, all this stuff. And the biggest disappointment came when my colleagues, I found most of them, do not really practice, do not want to transform. They would rather be a scientist and objective and aloof and just study the phenomenon and do it the same way as we did materialist science. Matter can be studied that way because we are not matter. We are not machines, and therefore we can study machines and matter by staying apart from them. We cannot be a machine anyway. And if we were a machine, we would not care anyhow. So there it makes sense. But for consciousness, even psychology, it just does not make any sense to take that position. And that I won't transform, then how can I talk about expanded consciousness? How can I talk about consciousness being the ground of being or spirituality? But there are so many people, Noam Chomsky, the famous linguist and also famous philosopher, he recently used a term that what America has intellectuals with values. Intellectuals with values, they are intellectual. They support the values, they have the values, but they don't follow them. They don't practice the values. This is the singular problem. And because the leaders don't practice it, so even when people follow us, even when people want to follow the principles, and then they find that the leaders are not changed, they are the same way, they still wear their pants one leg at a time the same way, no difference. This is just an analogy. What I'm saying is that you do wear your clothes differently, namely your persona differently when you transform. But if you don't want to transform, if you are the same persona, in spite of the fact that you preach that no, we should not have persona, we should not fake anything, and then how can people who follow change? This is why Valentina and I have gone ahead and established our own University of Transformation, where we can at least teach a few students who are willing to take responsibility for, yes, I want to transform. I don't care about words so much unless I can use the words in my own life.
Yeah.
You see, about, I see very clearly how so many lies are coming out, starting with the political, but also everybody, you are looking in your mirror, and if there are things that you didn't work with, now it's obviously the time, because the crisis otherwise will just show you that, So again, it's about the education which is needed, obviously. So it's to rip this polarized worldview and to give the integration a priority, and that's, societies have been reluctant to do because this sounds like such a long-term solution, always it's like it's too long. Now we just want a quick fix all the time, yeah? Mm-hmm. So imagine even a government or a president, what kind of beautiful power that kind of president or government could manifest, they could take some steps to help the people, because there are some people which are there, but they need some strength, So if a president would give a speech saying that this has gone too far, and we have acknowledged that some spiritual concepts and values and God even, so, and this is my position, For example, in USA, I was just talking with Amit today that indeed on the dollar bill, what you say, you find the word God, and God we trust.
Trust, yeah.
So of course, who's believing that, because people make an assumption that this is not true. And according to how governments behave and how intellectuals and everything, So it's an explicit statement that would really help, such a position of an authentic person as a president. But where do you find these presidents? Because all the presidents are, it's all this money power game there, and there are all kind of other theories of, about that, which may not be only theories. But still, I would very much be happy I would follow such a president, because people would get strength from such people, and then they will again convince others that there's so much evidence. So it's the time to break this worldview gap. Yeah. And again, the worldview is responsible for this lack of responsibility. It's materialist worldview, which gives no responsibility at all to people. And then the religious worldview, which gives responsibility to the clergy. But then, of course, they have their own problems. So they say, everything is fine. Yeah. So it's a hopeless situation, kind of,
Well, I think it comes down to, too, like we mentioned earlier, is that, there's a lack of leadership, I think, of strong leadership at whatever you want to call it for several years now. But B, I think it's also people want instant gratification. So they're not used to having this long periods of time where they don't feel like they can have any control over it. And it's like, I'll give you an example. I was giving a speech not too long ago, and somebody said, but I just want things to happen right now. And I laughed because I was like, we see this all the time. And I was like, well, let me ask you a question. I said, the universe prepares you for whatever it is on that you're setting your intentions for. It has to prepare you for that. And I said, let me ask you a question. Would you want somebody walking up to you and operating on you and saying they're a doctor, but they haven't gone to college yet? And they said, well, no. I was like, well, they'd say they're a doctor and that they could operate on you, right? And you needed it right away. You couldn't wait for them to go through the 7, 8, 9, 10 years of college. And they're like, well, I'd find another doctor. And I'm like, okay, well, then why are you wanting to rush your life? If you're becoming the doctor or the guru of your own life, why would you want to rush that training? And they start going, well, wait a second, that's different. I'm like, it's not really different. I mean, it's really not, because training is training. It's about whatever you're preparing yourself for. But that comes down to responsibility. And and even like there's the old principle, the Peter principle. Some of these politicians are promoted into those positions way above their lack of their lack of confidence or their ability to do the job. And so, I think there's a lot there where we have a lot of children managing the government, I guess, as emotionally, I guess.
Yes, I mean, that is the sum of subject. The leaders themselves have no sense of responsibility, and they themselves become childlike with panic. And therefore, how can they promote any confidence in the part of the people? And it is a shame, because we have enormous spiritual power that can be generated. Everybody can generate it quite easily, especially in emergency situations, because those emergency situations are ideal for evoking the spiritual power that we have potentially. But not a word in the media about it. And this also is a shame, because still 49% of American people are supposed to believe in religion. Even in the most recent poll, materialists are having the upper hand, but it's still only 51% who don't believe in God. So where are these 49% and their faith? A person of faith could not possibly be afraid of something like COVID and create trauma for himself or herself, till the panic that when suppressed becomes a trauma. It's just impossible, because that you have higher power. You know that the power of God will come to your rescue. And therefore, what is there to be afraid of? This is what spiritual power is about. This is what spiritual practice is about. That we have a higher power that we can garner, whether you believe in dualistic, God giving you, or you yourself have it. Those things are minor. The point is you have it available. There is spirit. That power is available. And if it is available, if you have that faith, then there is nothing to be worried about. And that's precisely what people lack the most. That is where responsibility comes from. That is where real freedom comes from. And the point is, people cry about stupid freedom, like I don't want to use mask. But that's a stupid freedom. Mask is not, you are using for your protection as well as protecting your own relatives and friends and stuff. So that's just common sense. Vaccine is another issue. I completely support people's right not to take vaccines, because these vaccines are genetically engineered, most of them, and genetically engineered anything of tampering with living cells is ultimately a little bit risky, you must admit. So I allow a lot of freedom for people on that score. But mask is another issue. I mean, obviously, you should not have gone into a crowded room without any mask, without any protection, whereas knowing fully well that in this situation, all of us can acquire the virus enough to contaminate others, even if we don't fall sick. So these are just simple thinking that lets you know how much down the road we have gone in terms of creating a very childish population. Politicians have become so used, both from left and right, of manipulating people. They are literally making the people dumb down to a situation. Well, media doesn't help. The social media, of course, is the main culprit. But people really just don't have anymore any strong feelings in their body, neither the heart nor the navel that gives us courage, no strong faith, intuition that gives you spiritual power. And then they fall total victim of the politicians from the right and left, and they're both manipulating us. And this is the tragedy. People have become childlike. They don't know anything. They just depend on this power of the politicians. I wish that could be higher power that they depended on, but it's not.
Yeah, people get really upset when I say, well, I don't know, I work for the greatest CEO in the galaxy. It's called God. And then they're like, well, you're not supposed to have faith in that. In people that are spiritual. And I'm like, okay, moving on. So I just don't engage in it because I think it stresses me out, and I want to be able to take my own responsibility for my own life. But so wrapping up our episode here. Let's talk. Is there any last minute advice and things that thoughts that you would like to give people with regards to this topic and how they could work through taking responsibility for their lives? As we wrap up. And I'll just
if you submit, she actually wrote a paper, research paper on this. So she's an expert on how we could have dealt with COVID, which would not have led all these calamities that eventually did.
Great. Actually, it's on the website. It's on the website. Check the website. There's an article. There is 2 or 3 parts of an article about Corona. You can get many ideas for healing, also the quantum perspective of healing, but even some natural remedies. Yeah. Okay. So I want to say just a few things that, of course, the crisis has gone way beyond the virus, and most people feel this intuitively, but just maybe some will not willingly admit it. Yeah, is this generalized sense of powerlessness and waiting for the outside to change and to solve our problems as an excuse, but things, I don't think they can go back to how they were, and that in order to move forward, we need more than just to say that. We really need that responsibility and realize that each of us needs to be part of the solution, and that the old is gone. We will not return to how it was, and there's a new normal kind of, yeah. So also, it's not about changing our perception of meaning. If we finally decide to find a life to live, a life of meaning and purpose, it's not about just reading something or following somebody or engaging some practice. That's just a preparation, yeah. And the same, you cannot just choose health by wishing it only. That's just being clever, yeah, which is fine, but it's more than that. Mm-hmm. So when you choose health from the spirit of exploration, you also do the lifestyle changes immediately, So it's what we call a quantum leap, which is needed to give a sense of direction that will help further. And when we do this quantum leap of fundamental creativity, meaning transformation, we have certainty in our pursuit. And then only we'll be able to master the energy to make the required lifestyle changes as they are necessary, But it's all a journey in happiness, in well-being as well.
Awesome. Thank you so much. And I just wanted to share, I guess, real quick. You said it's on the website. It's on the amitgoswami.org. And do you know where it is? Is it under the blog or?
Probably, yeah.
Okay.
Now they are changing the website, so I think so.
Oh.
Yeah, there, perfect. There you'll find coronavirus part 2. So there's part 1 and part 2.
There we go. Yeah, I just wanted everybody to see that. And then you guys will be, you were mentioning in the States here soon, or you're going to Brazil?
Yeah. Yes, we have to travel to Brazil, Mexico, USA, but in the States just shortly.
Okay. Does you have any lectures you're doing in the States where people can know about and come and see you, or?
Not in the States, but in Mexico. So
okay.
That's pretty good too.
Okay. Everybody check out their website. I'm going to be putting it into the description of the show. And there is a whole bunch of great information on there. You just want to go ahead and check it out. And then all of Amit's books are there, and Dr. Onisor's books are there. So check it out. And much love, everybody. Lots of great shows coming up. I've got Rex Sykes coming on. So we're going to be doing a panel interviews on the global post-traumatic stress, but also picking apart the law of attraction, because it's not just about positive thoughts. There's a lot to it. And so we're going to be bringing on this season a lot of topics and discussions on that. So everybody, much love, and thank you so much for watching the show.